So welcome to another edition of the COVID Supporting Doctors podcast, with myself and with Caroline Walker. Caroline, do you want to just introduce yourself?
Yeah, hi Rachel. My name's Dr. Caroline Walker. I am an NHS-based psychiatrist and I work full-time as a doctor's wellbeing specialist. I founded the Joyful Doctor, which is an organisation all about the wellbeing of doctors.
Great. And I'm Rachel Morris. I'm a GP, I'm an executive coach, and I created the Shapes Toolkit, and we work with professionals and doctors in high stress jobs and helping them with resilience in the workplace. And I'm host of the You Are Not a Frog podcast. So it's great to be back today. And this time we wanted to talk about expectations, because I have noticed in my conversations with lots of doctors, both inside my community, but also with some of my friends and some of my relatives, that we have really high expectations of ourselves at the moment. And a lot of us, I think, are seeing the coronavirus crisis as, yes, something that we have to endure, something we have to get through. But actually, you know, with our sort of capacity for development and for wanting to improve ourselves and wanting to make things better, we're actually seeing it perhaps as a time when we can do those things that we never got round to doing. We can do those courses, or make our gardens amazing, or get really, really fit, or lose loads and loads of weight, or do all this professional development. And been reflecting with some friends, actually had all these grand expectations, all these great expectations, and I'm so far not managed to do a single one. And is that your experience as well, talking to people?
Yeah, absolutely. I mean, I work with doctors mainly, as you know, and doctors tend to have very, very high and unrealistic expectations of themselves anyway, at the best of times. But I think particularly when we go through something a bit stressful, or something's changing, or our first instinct is to do more, is to be busier,
Yes.
is to be active, is to think, what can I do? And actually, we kind of almost need to do the opposite. We almost need to just go, oh, okay, something else has come along in my life that's going to take up some space mentally or emotionally, or, you know, that maybe I need to actually ease back and do less. But that comes, it's a very unnatural thing for doctors. You know, most of us are doers, and have very, very high expectations of ourselves.
That's so true. We are so geared towards action. And then myself, in any crisis, I'm like, right, how can we solve the problem? What can we do? What can I do?
Yeah.
And it's really odd to have this actually keep calm and do nothing.
Yeah, I was listening to a GP talking yesterday, actually, and reflecting on exactly this thing, that their first instinct was to just get busy, to try and help, to try and solve the problem, to try and think, okay, how can I fill this space, or do this thing, or help with this, or and they were talking to somebody else who was saying, actually, what they were doing, another doctor, was saying, actually, I'm just going to step back and do nothing for 2 or 3 weeks and let things unfold and see what might be best to do. And it's like, that's a really alien concept to us as doctors, because we're very proactive. We're doers, definitely.
Yeah. And why is that our reaction? Is it a stress reaction, or is it a sort of God complex reaction that we're the only people that can save things, or what is it about us?
I think it's different things for different people. I think there's lots of things going on, but there are certainly common trends that I see.
Okay.
And I actually think a lot of it may be driven by a sort of almost like a low self-worth or a low self-esteem type underneath, that we often have as doctors, and people often find that very surprising to hear, because doctors come across as being quite confident and quite comfortable in their own skin typically, but what I find is that quite often that's a bit of a mask to cover an underlying insecurity that's like, actually, I don't feel quite good enough, or I don't feel I've got, you know, they don't have that healthy self-esteem. So when something happens, when they get a bit stressed or a bit, it's like they try and compensate, to overcompensate, to try and you know, if I can do something and be useful and be busy, then I am a worthwhile. So it's very hard for doctors to do nothing, because they feel as if that's not okay. They feel as if that's not enough, that they should always be doing something.
That's really interesting, that we're not enough unless we're doing something. I think that perhaps has been drilled into us from when we were really, really small.
Yeah.
To get to med school, you had to get all these GCSE grades and then A-level grades, and and it was tough. And a lot of us find our worth in our achievements and what we've done.
Exactly. And we measure whether we are good enough by how other people react to us and praise us, and by our certificates and by our qualifications. And actually, often it's rare to come across a doctor that's actually just really okay just being who they are. And I think it's why a lot of doctors struggle to leave the profession as well, because there's something so tied up in their identity of being a doctor that's so important to their sense of being good enough, being a worthy person in the world. And so when something like this comes along, particularly something like this where there is a health element to it, where it's like a call to action for doctors, it absolutely feeds that cycle of like, you must step up, this is your time. And there's a lot of that language around at the moment, isn't there? To be heroic, to battle, to step up, to come forward and meet and fulfill your duty and do all of it. And actually there's an implicit message there that it's not okay if you don't do that. That if you choose to not step up, to not do something, to not be busy right now, to not be like doing everything you possibly can to help others, that's not okay. But actually it absolutely is okay. It is okay to not be crazy busy every minute of every day. In fact, it's essential if we're going to stay well and be effective as doctors.
Yeah, I completely agree. I think that's why it's so hard for the doctors that are having to self-isolate at home or shield, or maybe have been redeployed from their usual job. But actually there might have been, and I know there are lots of doctors who've been redeployed but aren't being used necessarily because they might not be as busy in their area as they were expecting to be, or something like that. And the feeling of being redundant is awful as a doctor, because actually most of us have never really experienced that before.
Yeah, and I think it's pretty hard for anybody, but particularly doctors, because we are just generally people who do and keep busy and are always finding, and we're very adaptable, and we have lots of skills, and so we tend to, in any given situation, if you're asked to do a group task, for example, the doctors will just will get in there and just do it, right, with that kind of approach. But I think at the moment, as you say, there's a lot of enforced downtime that kind of goes against the grain, and so doctors are left feeling a bit impotent, a bit like, well, what can I do, and our natural tendency is to want to do, so we're then frantically searching, as you say, to like, oh well, maybe I'll do this online course, or maybe I'll do this, get the garden perfect, or maybe I'll do. And I think to some degree a bit of healthy occupation and distraction is a really good thing right now, because when there's a hole, when there's a gap, when there's anxiety tends to fill that gap. So keeping a little bit busy and a bit occupied and doing something useful is great. So a bit of gardening or doing an online course is absolutely great, but it's about not kind of frantically trying to fill every minute and having unrealistic expectations of what you might be able to do, because you might sit there and think one night, oh, I'll do some gardening tomorrow, but you wake up the next day and it's the last thing you want to do. Because actually at the moment we're all going through something quite big emotionally, and it's really normal that one minute you might feel really motivated and really on it and I want to do this, and then next minute it's like, oh, I feel really deflated and like I can't be bothered. And that's really, really, really normal. So I think it's about not lowering your expectations, but just adjusting them slightly to take into account what we're going through right now.
Yeah, and then I remember just earlier we were talking, you were saying I don't never tell people about lowering expectations, it's about adjusting, and I like that.
Yeah, because, well, particularly for doctors or people who have generally high and unrealistic expectations, if you talk to them about lowering their expectations, they kind of get a really visceral, like, oh no, I don't want to do that. I don't want to be like underperforming or not being as good at my job or not being as good at my parenting, or people find that really hard to get hold of. So I just talk about adjusting your expectations. So it's kind of just a sideways step. It's like, I've got a week off next week, as you know, Rachel, and I'm hoping to do some writing on my book, but I'm not kind of expecting myself to do that writing. I'm kind of saying, okay, there's a space there. I might do it, I might not, because when it comes to next week, my brain and my emotional state might not be in the right place. So I think it's just holding it a little bit more gently, adjusting that expectation. So I might do this, as opposed to I'm going to do this, and then failing. It feels as if you're failing when you don't do it. Yeah.
So sometimes it's about actually changing the words, our self-talk. So I'd like to do this, or I might do this, as opposed to I ought to,
should.
Or I should.
Yeah, should is a big one I'm hearing at the moment. Yeah. And we were sharing, weren't we, earlier, about how there's quite a lot of people feeling quite flat this week, particularly here in the UK. I think we're just hitting that bit where we've been going for quite a while on adrenaline for a few weeks now, lots of high energy, and now we're all just feeling a bit like, tired. It's a bit grueling. With the lockdown's been extended, the schools still aren't back, and it's kind of feeling like, oh gosh, we really are in this for the long haul. And the reality is hitting home, and it's feeling quite heavy for a lot of people. So I think just acknowledging that and having some self-compassion, towards what we're going through right now, not expecting that we would feel really upbeat and energized and motivated all the time. There will be weeks like this where it kind of catches up with us a bit, and it's a bit harder.
Yeah, it's interesting you talk about self-compassion, and my observation, I guess, in myself quite a lot and in others, is that doctors aren't very good at feeling their emotions and then having compassion on themselves. I guess we've been, just taught that you just have to suppress them and get on with it. I remember as a junior doctor dealing with a dreadful trauma resus in A&E, and then like 10 minutes later, right, on to the next patient, go sew up that hand, or deal with that broken toe. And there's like no room for the emotions. I think things are probably better these days in hospitals. They're understanding about debriefing. Well, maybe the good ones are, and the importance, but we have got so used to squashing our emotions that when it comes to self-compassion, we don't really know how to do that.
Yeah, absolutely. So compassion is something that we're all born with as human beings. It's a very sort of natural thing that we all have from birth. And we tend to learn it. It's something called the compassion triangle, might be helpful to think about. So we tend to experience compassion in 3 different ways. So we experience it towards others. So that's the feeling you get when you see that picture of a starving child or somebody in pain in front of you, and you get this natural feeling of noticing their suffering and wanting to relieve it. That's what compassion is. It's noticing suffering and wanting to relieve it. So we all, and doctors have that in absolute spades, right? They are absolutely topped up with that compassion towards others. We're very, very good at that. We practice that all the time. We do that day by day. Another on the compassion triangle, another aspect of compassion is compassion from others. So that's where, like, say you're having a bad day, like you've done a really 12-hour shift and you're absolutely broken, and that nurse comes up to you and hands you a cup of tea, right? That's receiving compassion from others. They've noticed that you're struggling and they're trying to do something to relieve it or want to relieve it. And doctors we're okay at receiving compassion from others if we're broken enough, I find. So we don't want it. We kind of brush it off in day-to-day life. We're like, no, we don't want to help. We're fine, thank you. But if we're really broken, if we're really tired, then actually it can be lovely, and we can receive that compassion from others. The third part of the compassion triangle is to the self, and that's the one where the doctors typically tend to struggle with. So noticing that you're struggling, you're suffering yourself, and wanting to relieve that or trying to relieve that. But the brilliant thing is about compassion and the compassion triangle is it's all the same thing. So compassion is compassion is compassion. So if you can do it to others, you can absolutely do it to yourself. It just takes practice. So it's just about noticing when you're suffering and then wanting to do something to help that. And typically doctors will get a bit kind of lost when they first try doing this. So they'll have a bad day and they'll kind of go, oh, well, I'll crack open that bottle of wine. And that's the way that, they find these ways of trying to be compassionate to themselves, but that end up actually kind of not helping so much. So it's just learning those ways that you would do to someone else that are helpful. So, it's simple things like, if you see someone struggling, you might give them a hug. When you're suffering, you might need a hug. So it's really simple things like that, but just noticing. when you're suffering, and trying to find ways to relieve that in a healthy way.
How do we let's go really back to basics. How do we notice when we're suffering? Right, because I think we have all these emotions all the time. You know, anger, and then we get happy, and then, you know, a lot of us find it very difficult to actually identify that.
Yeah, because for many of us, particularly as doctors and healthcare professionals, where we've, again, had the focus has always been on helping others, we get really good at recognizing it in other people, don't we? But we aren't so good at recognizing it in ourselves. And it takes a bit of time and a bit of practice. And I would say it's easier to do it with other people. So if you're feeling something, it doesn't really matter. I've heard this from a few people lately, actually, a few doctors saying, I don't know what I'm feeling. Actually, I don't know what I need right now. I don't know if I need coaching or therapy or just to go for a run, or I just don't know. Actually, just talking through what you're thinking and feeling will help. So you don't need to know the right words for it. You don't need to know. You just need to share it with somebody, because actually we learn as human beings from each other. So I might say to you, Rachel, oh, do you know what? I'm feeling a bit like, I don't know, a bit snappy today. And then you might say back to me, oh yeah, I've been feeling a bit irritable too. I think it's because, you know, of this. And so we chat about it and we learn, like, oh, okay, it might be this. So I think it's about, it doesn't really matter what words you put to it or how you do it, but just sharing it with other people, I think, is really, really important. You talk a lot about check-ins for teams, don't you? And I think that's one way that we can do that for each other in this current environment, is to just allow a space as a team to just go around and say, how you doing? You know, and it doesn't matter what words you use. It's just putting some name to it. You'll then learn from other people. You'll be like, oh yeah, that's that what they just said, that fits. I think that's what's going on for me.
That's so true. Last week I was talking to a group of really good friends, and they're like, how are you, Rachel? I was like, I'm fine. And then I was like, well, I've got this thing on my mind. So by the end of talking about it, I was in tears. I was like, oh my gosh, I didn't realize I was so worried about this, or it was affecting me so much. And I think you know, often people, the sort of Myers-Briggs type extrovert personality, need to talk to know what they're thinking. There's a great quote from Peter Ustinov. I love being interviewed. It helps me know what I'm thinking. And I'm like that. I do have to talk it out, and then I know what I'm thinking. Other people actually like to internalize it and think through.
Yeah, and that's fine as well. And it's about finding a way that works for you, I think. So if you're somebody who doesn't, if the thought of having to say to someone how you're feeling absolutely puts the fear of God into you, then, you know, maybe listening to podcasts, reading books, or, you know, just being curious about what it is you're thinking and feeling, actually, you know, just scanning your body and going, oh, what's the feeling here? Is it a tightness? Is it a pressure feeling? Is it a kind of skin crawling? I don't know, just getting curious about it. And just, you can learn a lot about yourself, right? Just by asking, oh, what is this? How do I feel? And that's something we're not really role modeled how to do that growing up. And particularly in something like medicine, where, as you say, there's not that much of a focus on emotional health and well-being. It is improving, absolutely. But yeah, we're all learning all the time, you know, what are these different emotions, and even people like myself who are, you know, doing this for a living, I've been doing it for years, I've been on my own journey with mental health problems, learned a lot about myself. Even I struggle sometimes to know exactly what it is, you know, that's going on, and that's okay as well.
Really important journey discovery. What I find in myself is that I experience an emotion, and then I try to rationalize it, and then I try to fix it.
So typical kind of, we're quite in our heads as doctors, aren't we? So we'll feel something. Typically it'll be in our bodies, actually, where it starts. So there'll be like a tightness in our chest, or a nausea, or a tension, or something physical going on, or a headache, and very, very quickly we will try to intellectualize it. We'll try to think our way through it. And actually sometimes it can be really helpful to try and just drop back into your body and just notice what's going on in your body, actually, because emotions are very physical as well as thinky.
So once we sort of recognize our need for compassion, and when we notice when we're suffering, how do we then, well, I think there's two questions I've got. First, how do we then show compassion to ourselves? You said, you know, go and get a hug from someone. what if there's no one around? What if we're in that position?
Yeah.
And then my
Yeah.
question is then, how do we get it from others? Because I think we're
Yeah.
really bad at receiving it from others. Let's start with self
Yeah.
first. What
Yeah.
other healthy techniques are there for self-compassion?
So I actually think the hardest bit is actually just that very first bit, is noticing that something's going on.
Right.
So actually having that check-in. So I remember when I first had my son, I was really, really struggling with some postnatal depression and some high mood as well. And one of my health visitors kept asking me, "What do you need right now?" And this really stuck with me. And I wrote it on a Post-it note and put it on my wall next to my chair where I was doing a lot of my breastfeeding and stuff. And I just got into the habit of asking myself, what do I need right now?
Yeah.
So it's not so much actually, Rachel, the answer to that question, because isn't what it's about. It's actually asking the question in the first place, because the answer will be different in on any given day at any given time. So sometimes it's, I need a glass of water because I'm thirsty, or I need to eat because I'm hungry, or I need to sleep because I'm tired, or I need to get a hug because I feel lonely, or I need a hug, or I need to cry, or it could be anything. So I need to read, I need some time to myself, so the answers are literally limitless, but it's just asking yourself that question, what do I need right now? Yeah, getting really in the moment about it. And typically as human beings, if we give ourselves permission to ask that question, we will know the answer more often than not. And if the answer doesn't come, you go, I don't know what I need. That's okay. You just wait a little bit. You say, okay, well, I'll just wait a little bit and I'll ask myself again in 5 minutes or 10 minutes or half an hour, or it's okay. We don't always have to do something. It goes back to that idea, doesn't it? Of like, we've always got to fix something or change something. But actually with emotions, they change anyway, naturally. Often, whether so you might not know what you need right now, but in 5 minutes time, it will become obvious that you're really hungry, or you just need to cry, or So I think it's about asking the question first of all.
Yeah. And I guess there are things that you can do, like for me, if I don't really know what I need, sometimes just getting out and going, we live near a lake, and just walking around that lake, by the time you come back, I'm like, oh yeah, that's what I need.
Yeah, so a little bit of distraction again, a little bit of just taking your mind off the problem. It's that idea, isn't it? You put it on the back burner, you kind of stop overthinking it, stop trying to solve the problem, and actually it tends to solve itself. So maybe you go to bed and you wake up and the solution magically appears, right? So it's sort of asking your question, what do I need right now? And if you know the answer, great, then you can start to think about how you meet that need. If you don't know the answer, then maybe just do something else for a little bit, and then the answer may come.
Yeah. So that's really great advice. So just stop, what do I need right now? And giving your permission to get what you need right now as well.
And we're hearing this a lot from doctors at the moment, with particularly around difficult issues like PPE, for example. Because again, we get very up in our own heads trying to solve the problem. So there are doctors out there who are kind of desperately trying to work out how they can access enough PPE. And actually, if we stop and just think, what do they need right now? They need to be safe. That's what they need. And actually the decision may be, and it's a very hard one, but the decision may be to not go to see that patient because you haven't got adequate PPE. Because actually if you think, what do I need right now? Well, I need PPE. Is the PPE there? No. Then what do I need right now? Well, I need to be safe. So what do I do? Well, I keep myself safe. And that's really hard. And we've done a webinar on moral injury, haven't we, Rachel, talking about how that can then generate, other difficult feelings. But I just think it's a good point to illustrate that if you just keep asking yourself that question, what do I need right now? You will get to the right answer eventually, even if the thing you need isn't there. So like you alluded to actually really nicely, that you might need a hug, but there's no one there to give you a hug. So it's like, well, how could I get that need met without there being someone there to give me a hug? And you can hug yourself. I know it sounds ridiculous, but you can actually. And because we, as human beings, we love touch. We love to feel held. So actually hugging a teddy bear, or I know it sounds ridiculous, but actually it meets a little bit of that need until you can then meet it with when somebody is available.
Or even doing something like, I guess, having a bath, which is very physical, isn't it?
It's
That gives you the
warm
cocooning, warm
Yeah.
Connecting with, so, you know, phoning a friend is, well, obviously not in the bath. Well,
yeah. Well, maybe.
maybe depends what sort of friend it is.
Oh, we'll start a new Zoom trend, zooming from the bath. Brilliant. I love it.
Yeah.
You're right. It's about what's that hug going to give me? Well, it's going to give me a
Yeah.
sense of safety, warmth, connected physical feeling. Well, how else could I get that? Maybe a hot water bottle or a bath, or absolutely.
And I was just thinking actually, what's the underlying question you need to ask? So I need PPE. Why? I was thinking to be asked why. I don't like the question why. It's too harsh. But what's that going to give me? What's the PPE going to be? It's going to make me feel safe. I need a hug. What's that going to give me? It's going to give me human connection and love. Okay. I need human connection and love.
Yeah.
So what do I need right now?
That? Yeah.
I need a glass of wine. Okay.
Yeah.
What's that going to give me? That's going to give me a sense of, well, of relaxation and just being able to let things go a bit more. All right. That's fine to have that glass of wine, but if you're feeling that you maybe need an entire bottle of it right now to get that, what else could meet that need?
Yeah, exactly.
Yeah. So that's a bit about compassion for ourselves. You know, I was talking with an elderly acquaintance the other day who is an ex-GP, and he is at home self-isolating like he should be. He's sort of mid to late 70s. But he was really struggling with the fact that his 60-year-old neighbour had offered to go and get him his prescriptions for him.
Okay.
And he was saying, well, why are you struggling with that? Well, because, you know, he's putting himself at risk, and, you know, I could just go and get it. You're like, yes, but you're nearly 80 and he would really like to do this for you. In fact, that would, he said, oh yeah, he's very keen to do it. I said, of course he is, because actually giving to others is a well-being factor. It makes us feel good. It's a way that he feels he can help in the coronavirus crisis. But, you know, this person found it very difficult to accept. I think they've been a GP all their lives, and they
always
were
caring for others.
Always the person that cared for others. So I think we are really bad at receiving this from others, compassion, help.
I think we're not practiced at it, I would say. I think we can do it, like I said, with the compassion triangle. When you can give compassion to others, you can give it to yourself and you can receive it from others. You just need to practice, and it gets easier with practice. Like everything else, it gets easier. So, and you're spot on. That person, allowing them to help you is a gift to them, because human beings love to help other human beings. We just love it. So every time you say, oh no thank you, that's really kind, but no thank you, you're actually denying that person an opportunity to feel good about themselves and to do something useful and helpful. So although it comes from a very good place, often doctors don't find it very hard to accept help from others. It comes from a place of wanting to try to do it themselves and to not burden other people. Actually, I think we have to recognize that in doing that, we're actually not allowing that other person to be the full human being, and that have the wonderful experience of being able to help people that we get as doctors. So as doctors, we get to help people all the time, and we know how good that feels, right? We all know, if we're honest about it, it feels amazing when somebody says to you, thank you, thank you doctor, that was great, you made me feel so much better, or you reassured me, or thank you so much, couldn't have done that. It does feel really good. And if you can let others help you, it gives them that feeling. And it does get easier. I promise, I never used to accept help from people ever. Now, oh my goodness, it's one of the first things I try and do. If I'm struggling, I'm like, okay, who can help me with this? And I almost try and list out, well, that I could ask this person this and this person this, and they absolutely love it. And people will say if they can't do it for whatever reason. Yeah.
So practically, what can doctors ask of other people at the moment?
Oh, anything and everything. I mean, anything you think of. Like, we're seeing great examples, aren't we, of food being delivered to hospitals, people picking up medications and food shopping for doctors that can't get out to the shops, or, just honestly, anything and everything. Going back to that question, what do you need right now? Ask that, and then whatever that is you need, you can ask for that. So it might be a basic physical need like food and water. It might be an emotional need. It might just need, actually, would you mind if I just phoned you and just told you about my day? Because it was really tough. So anything, literally anything. Yeah.
So one thing that's in the back of my head, I know that when we sort of read a lot about self-compassion, and I've got the bit by Tara Brach about the rain therapy and stuff, and a lot of it is about recognizing and stuff, and a lot of it talks about sort of these meditative practices and mindfulness and things like that. How can mindfulness and meditation and all those sorts of things help with sort of self-compassion and adjusting expectations and all those sorts of things?
Yeah, I mean, they absolutely can help. I think they are quite tricky to do if you've never done them before. So I'd go lightly to start with and just try with something like an app, or there's lots of free apps out there at the moment for frontline NHS workers, things like Headspace and Calm. And I think where they can be really helpful with self-compassion is they can help you to start to notice what you're feeling in the moment more easily. Right. So I practice a bit of mindfulness. If I don't do it very often, we sort of go into autopilot. And then that's when you do find that you come home and you reach for that extra glass of wine or that extra chocolate bar, or you snap at your partner without thinking about it. Whereas when you practice something like mindfulness or meditation on a regular basis, it is a practice. It's not like a one-off thing. When you do that, it becomes much easier to notice what you're feeling. So then you might get back after a bad day and be like, oh crumbs, okay, I'm actually really struggling today. That was a tough day. Okay, all right, what do I need? And so it can just give you that little bit of space, I would say, where you're more in tune with what's going on internally, and then you have a choice as to how you respond to that in a more healthy way. So I think that's the biggest way in which it can help at the moment. I mean, generally it lowers levels of anxiety. It can help you to feel more focused. But I think it's about just having more awareness, I guess, of what you're feeling and going through in a moment-to-moment basis.
Yeah. I think it can also maybe help with the, when you recognize, I'm all like this, what do I need? Sometimes what I need is to calm down, and that can really help. And it never, I've been trying to do 10 minutes of mindfulness a day. I use Headspace, which I really love. It's really great. But it never feels like I'm achieving anything, because I don't have this like result at the end of it. So I think practicing meditation is a self-compassionate thing to do, which is much more about being rather than doing. If I do 10 minutes a day, I'm not going to get a certificate in mindfulness practice. Hasn't she been good, and look what she's achieved?
It's not about that.
So it's not something that you achieve, but it's something that will make you feel a lot better. And actually long term you will achieve, I think you'll achieve more if you manage to sort of manage your mind, won't you?
Absolutely. And it goes back to what we were saying right in the beginning, that as doctors we particularly find it quite hard to it's not about doing nothing, but it's just about sitting with your thoughts and your feelings, isn't it, and noticing them and not judging them. And I think that's something we really struggle with as doctors. So mindfulness is essentially a non-judgmental observance of what's happening in the moment. And as doctors, we're highly critical. So we'll be sitting there trying to do our mindfulness activity, and it's like, oh, my mind's wandered off again. Oh, I can't do this. Oh, everyone else looks really blissed out and happy. Oh, why can't I do this? And so our internal monologue is like a very critical kind of like, oh, you're not doing this right. It's a judgmental, it's harsh. So mindfulness can be really helpful with that, because you can learn how to not be so judgmental of your moment-to-moment experience. It's like, okay, today I feel a bit sad, or today I feel a bit angry. That's okay.
Yeah. And self-compassion, I think, is about getting rid of the judgment on ourselves.
It is.
I'm rubbish. I'm not coping very well. I'm a bit useless. I'm weak. Not like all those. For some reason, it's okay for patients to feel stuff. Not for us, for patients not to be coping, because they're under a lot of stress. But no, but we so let's get rid of that judgment about what we should or shouldn't be feeling.
Absolutely.
So Caroline, if people were particularly struggling with this and want to find out more, are there any sort of resources around self-compassion that would be helpful?
Yeah, I mean, just Google it. As with anything, there's so much out there. I love the stuff that Deborah Lee and Paul Gilbert do. They've got some great books around compassionate theory, mind theory, and compassionate ways of working with different types of problems. I suspect Deborah Lee's certainly done a book about the compassionate approach to trauma therapy, and I suspect some of that stuff's going to be very helpful for people in the coming weeks and months as we face more trauma through COVID-19. Google compassionate mind theory, compassion focused therapy, that sort of thing. If this interests you, there's lots and lots of stuff out there. But again, just bring it back. You know how to be compassionate, right? All it is noticing suffering and wanting to relieve it. That's all it is. So I would just invite people to practice it, actually. So just to check in, what am I feeling right now? What do I need right now? And that's it.
And every day ask yourself, what have I done to show compassion to myself today? What do I need? Great. And so just a reminder to people as ever, if you are struggling and you need some help, then please reach out and get it. And the Health Practitioner Programme has all sorts of resources there. You can get one-to-one help, you can access webinars, anything else on there? I mean, there's just everything.
So the website is practitionerhealth.nhs.uk, and they have a fantastic COVID wellbeing resource page. There's a wonderful calendar on there now where you can see all the different daily things that are going on. There's mindfulness classes for free. There's drop-in common rooms where doctors can just drop in and show compassion to one another and just share what's going on. There's also I just want to highlight the National Frontline Workers Support Line that you can call any day, 7 a.m. to 11 p.m. And the number is on the Practitioner Health website. There's also a 24-hour text line. You can text Frontline to 85258.
85258, just writing that down. And of course, reach out to your own networks, and many, I know, hospitals and departments are putting on their own wellbeing stuff. Lots of you are in Facebook groups, communities. Do reach out to us if you'd like to get in touch. We'll put all our details in the show notes.
Please do.
So Carolyn, thank you so much. That was really helpful.
My pleasure.
And we'll see you again for the next episode.
Look forward to it.
Okay, thank you. Bye.
Bye.